Welcome to the press briefing. We have Dr. Chuang Shuk Kwan, Head Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Chuang will first give you an update on cases. Good afternoon. There are 2,286 PCR positive cases yesterday. 2,189 RAT positive cases in total, 4,475 positive cases. And since the start of fifth wave, we have a cumulative total of 1.155082 million cases, 754,000 PCR cases, and 425,000 RAT positive cases. And among the positive cases yesterday, 2,340 reported by the HA 408 by the Public Health Laboratory Services Branch, and 1,558 cases reported by private contractors. Those are PCR positive cases. And among the cases yesterday, 1,536 samples were analyzed by the Public Health Laboratory Services Branch for negative cases of 1,263, and for 53 cases we couldn't do the genetic analysis yet, either or the prior load is too low. And then among the cases yesterday, 18 are imported cases, 13 involve people who arrived at Hong Kong on the 1st of April. 4 arrived on EK 83842 on SQ 894. For the remaining cases, they came on various flights. 5 cases involved people who arrived earlier. 2 were crew members arriving from the United States. For EK 384, there are 4 passengers who tested positive on arrival. So under CAP 599H, between the 3rd and 9th of April, the United Emirates will be prohibited from sending flights to Hong Kong. We have not received any report of homes with new infection cases, and then there are cases that involve about less than 100 residents and a dozen or so staff members. On death cases, the Hospital Authority reported 116 death cases. The deceased all had positive COVID-19 cases reports. And then so far, since the start of fifth wave, 7,795 death cases have been reported by the Hospital Authority, and there are 53 death cases reported by forensic pathologist, and 2 cases reported by the Chinese University. And so far, there are in total 7,848 death cases in the fifth wave. Among that, 3,188 were female, and 4,660 of the deceased were male. The death rate is 0.06%. That's all from me. Dr. Ho, please, on the Hospital Authority. Good afternoon. So far, 10,133 confirmed patients are at the North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, AWE Community Treatment Center, and so on. And yesterday, 15 cases were in critical condition, 27 in serious condition. 79 of the critical patients are now in ICUs. As at 00 hours today, in the past 24 hours, 99 patients who tested positive for COVID passed away. 59 male and 40 female, aged between 47 and 109. And among the deceased yesterday, 42 came from residential care homes, 57 had no vaccination record, 22 had 1 dose, 18 had 2 doses, 2 had 3 doses. 89 of them were elderly, aged 65 or above. And now there were a few relatively younger patients. I would like to report to you about their cases. There are 4 cases actually. All of them had cancer. A male 59-year-old, 57-year-old male, 47-year-old male, and a 49-year-old female. They had lymphatic cancer or pneumoconiosis, and also suspected lung cancer, and also metastasis of bowel cancer, and there's another one with cancer. So there's a backlog of cases. So between the 3rd and 31st of March, there were 17 death cases that were not announced before. 8 male and 9 female, aged between 64 and 98. In the past day, 1,439 patients were recovered and were discharged, and 2 patients tested positive upon admission screening or in hospital screening, and 3 in the same ward listed as close contact for staff members. So far, 21,225 staff members have tested positive. 19,056 have recovered and are back at work. As for the AWE Community Treatment Center, there are a few new arrangements. Now we're now operating halls 8, 9, 10, and 11 as treatment centers in the AWE. The mainland support teams have started work at AWE to take care of their patients. So we have increased the number of COVID-19 patients at AWE to about 400. We're going to increase the number of patients to be treated at AWE gradually. For the other halls operated by the hospital authority, there are still beds available to take more patients. As for the halls operated by the social welfare department, they will be handed back to the hospital authority soon. For now, the hospital authority will not operate these halls to be handed over by the social welfare department, but we will closely monitor the epidemic, and if necessary, we will make use of these halls to take in more patients. But for the time being, we don't have planned to operate these few halls. Okay, the floor is open. Questions, please. First, identify your organization before you ask questions. The lady there at the back. I'm from Now TV. Yesterday, it said that there are 2 travelers arrived at Hong Kong with Omicron XE recombinant strain, but eventually it's an XE variant, but then eventually it's clarified that they have a BA.1 and 2 recombinant. So is it the case that we haven't yet had a XE variant strain? If Professor David Hui said that if the number of daily cases is 3-digit, then we could do a compulsory universal testing. So how would you assess the current trend? Now, with the flight ban removed yesterday, there were 18 imported cases. Is that expected? How would you assess the situation about imported cases?
For the 2 imported cases, with the BA.1 and BA.2 recombinant viral strain, I found out that with Dr. Leo Poon from HKU, so it was my mistake, because I thought BA.1 and BA.2 recombinant automatically means XE, but then there are different varieties of recombinants involving BA.1 and BA.2, where XE is just one of them. So the cases I mentioned is different from XE, so that couldn't be classified as a case of XE. So after the discussion, the conclusion is that we didn't find any more community cases involving the recombinant. So the 2 cases we found back in February posed little threat, but there are imported cases, so we will be monitoring the development. For the infections we see now, they are dropping. The trend is a steady decline, but we're still seeing thousands of infections every day. If more people are out and about in the community and people drop their guard, then there's a risk that a rebound will happen. We have adjusted the border control measures for arrivals. Some people were stranded, and now they can fly back in. So some imported cases are expected. Next question. At the front, the journalist in white. News. First question. Today, the chief executive announced that there will be a 3-day RT test, and people have to report their positive test result. We had the universal testing in the past, but the result was underwhelming. This time, we're encouraging people to do the RT test voluntarily. So is there a chance that this will be met with limited success? Will there be incentives for people to do the voluntary RT test? Today, the chief executive also said that there are more than 90,000 tests are done with PCR tests these days. But there was a time when we had 200,000 PCR tests done every day. So exactly how many PCR tests are we doing every day now? Will that capacity enough for compulsory universal testing when we have it in the future? We have heard reports from our readers that hotels for the medic workers, these workers can bring their families and friends to the hotels and have something like a staycation. Do we have such hotels? Are there regulations regarding what the medical workers can do at those hotels? I know that the government has started distributing the anti-epidemic service bags to the people. There are rapid antigen test kits in these service bags. So this morning, the chief executive encouraged people to do tests with RT test kits next Friday through Sunday to gauge the infection level in the local community. In the next few days, there may be publicity, API, etc. So I believe there may be government announcements to come. We're doing roughly 90,000 PCR tests every day. The positive rate at roughly 4%. At most, we can do around 300,000 PCR tests every day, but if we're doing a CUT, we may need assistance, and we may not be able to do that on our own. So if a CUT is conducted, it will be a major undertaking. For our staff, we arrange a hotel accommodation for them, just so they can take a break after they're off duty. That's an extra option for our staff. That's for our staff to rest. We haven't received complaints like that, but I believe our staff are aware of the purpose of this arrangement. Next question. Speaker's not using a microphone. The purpose of this arrangement is for them to rest. Because we've had staff concerns that they may have family members with pre-existing health conditions, and the staff members don't want to pose further health risks to their family members. So we will explain again the purpose of this arrangement to our staff. Next question, journalist at the back. Cable News. The government has mentioned this RT test next week. How effective do you think it will be? Will the arrangement simply pick up cases with lower viral loads? Will the online platform for declaring RT test results be able to cope with the possible positive cases to come? Will the isolation and quarantine orders be issued in a timely manner? For our isolation facilities, can they cope with a huge amount of confirmed patients? At its peak, how many confirmed patients can the facilities take in? Or will the RT arrangement simply fall by the wayside? Or just get the information without being able to follow up? The third question, just then another journalist asked about the new variant found in the UK. but we have just lifted the flight ban on 9 countries. A question for the CHP. Why has the Center for Health Protection not announced the 2 cases involving the new variant? Which day in February were these 2 cases found? What's your assessment of the transmissibility of the new variant? After all, we have just lifted the flight ban. Where will that pose a high risk to Hong Kong? And a question about the antiviral drugs. Do the antiviral drugs work on the new variant? The scientific committee mentioned the possibility of giving the elderly a 4th dose of the vaccine. So does that mean that the rest of the public will have to do the same thing? About the RAT, they pick up cases with a higher viral load. That's when people test positive to an RAT test. PCR tests can pick up cases even when the viral load is lower. For isolation orders and quarantine orders, they are issued automatically through our platform. So once people declare their positive results on the online platform and then upload their ID and the picture of the test result, the isolation order is then issued automatically, so manpower is not an issue here. As for isolation facilities, there are tens of thousands of beds in those facilities at the moment. Given the COVID situation now, the facilities shouldn't be posing a bottleneck here. For the 2 travelers found with the BA.1 and BA.2 subvariants, the COVID virus is constantly changing. We have this surveillance system in place. The CHP and the HKU and other universities are doing genetic analysis of the virus, and we're monitoring where the virus is going. So we don't announce just every single variant there is. But the UK has found out about this variant. And for us, we've just found out the 2 travelers were carrying variants that are different from the one found in the UK. These being imported cases, they pose very limited risks to the local community, and that's why we did not announce it the first moment we found it. But we do have a mechanism in place to monitor how the virus is mutating, and if there's a need, we will make announcements. And as for the meetings of the scientific committees, there are regular meetings. And any recommendations made at those meetings will be announced. We'll take an English question.
Some English questions from the South China Morning Post. Firstly, about the imported cases again. So obviously the flight ban has been lifted, and already 1 flight is going to be suspended because of the number of positive passengers that it carries. So do you see that more flight bans will be instituted? Does this show that actually the coronavirus situation around the world is also not as stable, and will there be enough support in Hong Kong's health facilities to cater to the influx of imported cases going forward? And can you repeat a little bit about the genetic sequencing of the new cases? How many were suspected Omicron and how many are suspected Delta at the moment? And also for the AWE, can you explain the patients, the 4,000 patients there, and how will the facility be managed, and how will the manpower be deployed?
I think the increase in number of imported cases is expected because previously we have banned some countries from flying to Hong Kong. So all these imported cases will be isolated and treated. So, and for the genetic mutation, you mean among the 1,316 cases with variant analysis being done by our laboratory, 0 of them had L452R mutation that mutation signifies suspected Delta. So not yesterday's case, we do not have any suspected Delta cases among those being analyzed. And 1263 had L452R tested negative. And then the rest, 52 were viral load insufficient or pending. So for the 1263 L452R negative cases, they are suspected to be Omicron.
So at the moment, and under the support from the government and hospital authority is operating the number 8, 9, 10, and 11 of AWE as COVID management, COVID therapeutic center. And we have sent 20 doctors and around 100 nurses and also supporting staff to station in there. And with the support of the central government, and they have also sent around 400 China delegates and to support the AWE. And at the moment, we have around 400 patients under the care in that center.
Next question, please. The lady in front, please. I'm from Ming Pao. Dr. Chuang mentioned import cases apart from the flight number. Can you tell us the origin? For the 9 places with the flight bans removed, how many imported cases were there? Now you are doing about 90,000 PCR tests each day. The positive rate is about 4%. And this morning, the CE mentioned that the Hong Kong University is doing a point prevalence project. So how come, they have a reading of 2%, so how do we read into this 2%, and how does it show the infection level in Hong Kong? As for the universal RAT test, would the CHP suggest that for those who've recovered from COVID in this wave to take the test? Let's say on day 6 and day 7, the RAT test result is negative. And then if they do RAT again, is it possible that they will get a positive test result again? And then CE mentioned that for RAT done from the 8th to the 10th of April, people should report positive cases within 24 hours. But now people could report cases within 48 hours. So would there be any special arrangement regarding that 3-day period for the universal RAT? First, imported cases. For arrivals yesterday, they came from the Philippines, Singapore, Switzerland, Spain, the UK, Thailand, UAE, and the Netherlands. There's one arrival from the UK. I mentioned the positive rate of PCR test 4%. Is because in the last day or two, each day there were about 90,000 PCR tests of different groups, and so that's roughly the positive rate. But of course, earlier the percentage would be much higher. Now it's about 4%. As for the Hong Kong U point prevalence project, I understand they use RAT. They have a group of volunteers, and each day they will report positive cases. Maybe each day 1,500 people will declare their RT results, and maybe so many test positive. And then the same group could report their test results again as long as they test positive. So that's the way for them to project as to how many people in Hong Kong test RAT positive. Now, I just read online it's about 1.21%. That means out of a population of 7 million, maybe 70,000 to 80,000 people test positive. And this could include those who have just become positive recently or who've been infected a few days ago. So it's not necessarily new cases. But of course, it's all estimate. It depends on the sample taken, whether it's representative of the whole population. So it serves certain reference value, but then we're talking about different things. What I'm telling you is that we're talking about, say, high-risk groups or specified groups who need to take the test regularly, and say they are served CTN's compulsory testing notices, then the positive rate will be higher. And now many people just take the PCR test in the community, and here the positive rate is about 4%. So here we're talking about two different sets of data. Sorry, speaker is not using microphone. Now, for RAT, if someone is recovered, in theory, when someone has tested negative, and then the chance of a positive is slim. It's not the same as PCR because with the residual virus, it could still be detected in a PCR test. The chief executive mentioned declaration within 24 hours. I think the point is for people to report their cases as soon as possible. It's also the principle in our current online declaration system that is if you do a test today, you test positive, you should report the case today. But if you can't do it today, at least you should do it tomorrow morning. So that's what we would like people to do. Last question. I'm from TVB. For the AWE facilities managed by the Social Welfare Department, they were handed over to the hospital authority. How many beds are we talking about? And then with this new recombinant, what are the symptoms if one is infected? Yes, the SWD operated facilities will be handed back to the AWE rather. What do you mean by that recombinant? Sorry, it's because they're using microphone. I think you have to ask the Social Welfare Department because these are facilities managed by the Social Welfare Department. What is your second question again? Sorry, speaker is not using a microphone. The speaker is not using a microphone. Oh, you mean that recombinant? Now, first, for these two patients, their symptoms are not any different than those of other patients. But WHO, if you're talking about XD, XE, they're still studying these recombinants. So far, they have not classified them as a new variant strain. As for their transmissibility and the gravity and so on, there still needs to be more analysis. Thank you. That's the end of the press briefing. Sorry, speaker's not coming through. Point 68. Thank you.